Hello there, Dr. Hewlett here, and today I want to talk about the difference between traditional surgery for joint pain versus these new regenerative cell therapies for joint pain. Surgery, for example, let's talk about the knee. Surgery has its place. On the scale of least invasive to most invasive and aggressive, it is at the highest level. It is the most invasive and the most aggressive form of therapy. Now in healthcare, what we do is we start with the least invasive, the least aggressive, and then we progressively work toward the most invasive, which is surgery. And so when it comes to surgery, the reason it's the most invasive and most aggressive is because there are multiple known risks. We do what's called a risk versus benefit analysis in healthcare. We know the risks include being put under using anesthesia and complications that can arise from that. We know that there's risk from cutting through multiple layers of muscles, ligaments, and tendons to get to the damaged knee joint. We know there's the potential risk of infection when you open up that joint. We know there's a risk of damage when you have to cut off part of the bone to put in the artificial pieces, and so forth. And so on that scale, surgery has its place, but there are several potential risks involved for the potential benefit of that. And so how does that compare to regenerative cell therapies? On that scale of least aggressive to most aggressive, regenerative cell therapies is on the side of one of the least aggressive therapies for joint pain, and one of the most effective because there are very, very, very few risks associated with it, but many, many known benefits. When these regenerative cells get injected into the joint, it does not have to involve anesthesia. It does not involve cutting through multiple layers of muscles, ligaments, and tendons, and the risk of infection is very, very minimal because we're not opening up that joint completely. These regenerative cells, when injected into the joint, they help to kickstart or initiate a repair process from using your body's own white blood cells or immune system to repair the damaged tissue in there. Very similar to when you break a bone or when you cut your skin, you have immune system cells that come to repair that damaged tissue. Well, these regenerative cell tissues act in that same manner and help to lead that charge inside the joint. And so if you're someone who's been told you need surgery or on that scale, you're looking for something that is least aggressive or lower aggressive, but highly effective, we invite you to consider regenerative cell therapies before you have a more aggressive surgery. Give us a call. We'd love to help you out.